All
Hello.
right. Hello. I'm going to rearrange this a bit. There you go.
Hi,
Hi, Nadine.
Nadine.
Hi.
How are you doing today?
Good. Thank you. How are you?
I'm amazing. I'm very excited for our conversation today. Thank you
Yes,
so
me
much.
too.
Thank you so much for joining Strawberry Health to discuss hormones, fertility, and what our labs can actually tell us. Such an important topic. So, let's do a quick introduction for our followers. I'm Svetlana, one of the co-founders of Strawberry Health. And at Strawberry Health, we help women understand their hormones through at-home blood testing and a platform that provides hormone insights, what they mean in your situation, and any follow-up steps that we may recommend to you. And I'm joined today by Dr. Nadine Al-Kaisi from Eggcellent Fertility. Dr. Nadine, I will let you introduce yourself and what you do for women.
Yeah, hi, I'm Dr. Nadine. Thank you for joining us today. And I'm a fertility doctor and reproductive endocrinologist from Germany. And I moved now 1.5 years ago to the Bay Area. And yeah, so I kind of needed to invent myself again. And then I figured out that women have a lot of questions about their fertility, about their hormone health, and about their labs.
Oh, yeah.
But doctors and nurses mostly don't have the time to give you like proper answers or to deep dive in your story or to go like deep in your lifestyle. So I figured actually that's what I want to do. That was also missing when I worked in a clinic, that I didn't have enough time with my patients. So that's why I founded Excellent Fertility. And now I'm helping women on their fertility journey, on their perimenopause journey, or like in general, if they have hormone health problems. Yeah, that's what I'm doing now.
That's incredible. When I first met you in the summer, I was really drawn to your mission to help women beyond their medical appointments because we
Yeah,
all know how rushed these appointments are. Doctors don't have time to answer questions. Sometimes they don't even have the right information because
yeah.
there is so much information around there and new research is coming up all the time. And it's really important to have this support by your side, especially when you're going through a fertility journey. So it's
Yeah, I feel also
amazing.
it's also quite hard to find the right doctor or the right support. So, of course, there are fertility clinics. So, once you have a problem with fertility, okay, you can go there. But once you have a problem with hormone health, it's a lot trickier because your OBGYN might not be the expert for hormones. Then you get sent to different doctors and different labs. And so sometimes it's quite nice to have it like in one hand or to have someone who's discussing it with you and then see which next steps make sense.
Yeah, that's true. So if we take all of the women that you work with, what is some of the most common concern or request that women are coming to you with?
That is actually a bit of a tricky question because it depends a bit where they are in
Right.
their life. So I would say I have like two like for fertility at least I have like I think two factors or two women who have questions about. So I think one part are like they are already in a fertility treatment, are already deep dive, like I don't know, had like a few IVF trials already or a few embryo transfers and just want to have answers or more support or wish to have consultants about which tests make more sense or what they could do differently or want to deep dive more in their lifestyle and their egg quality, something like that. Or I have women who just start their fertility journey and are curious, like for example, how good their AMH level is, so how many egg reserves they have. Some are already a bit older. I mean, we're in the Bay Area, both of us, so a lot of women have their careers and they build maybe a business, and everything happens in their early 30s, mid 30s. So building a family or having kids might be a bit tricky when you're supposed to have them because when you're younger. So some are actually seeking for help because they just start trying and are concerned that they might have problems or they just want to have support right away.
So I hear that you have two main categories. Some women are
Mm.
already on the journey, and some are trying to be proactive and understand where they
Yeah,
stand.
yeah, yeah.
And What is the most common hormones misconception that you see women are believing in?
So that is a bit maybe more like about perimenopause or like hormone health. So a
Mhm.
lot of have the problem that even so they don't know that even in your late 30s, it could start that your hormones are changing. So they feel a bit off, or they have, I know, the PMS is more strong now, or they feel like they forget things all the time, or feel a bit like not in their I don't know that they're center anymore, that they are like different than they were before. So that is I think a big myth that you think, oh no, that's not perimenopause because perimenopause happens like end 40s.
Mhm.
Or same as for fertility. The biggest myth I think is that you can have kids even though you're 45. Because I guess like a lot of like celebrities were, or I think also the media were like giving us the picture that, oh yeah, I mean, I don't know who I mean, we're quite bad with celebrities, but some had like 45 twins and it was totally normal, but no one tells them
Mhm.
that might be a long journey, or
Yeah,
they maybe froze their eggs in their 30s, or it was maybe even an egg donor. So I think
totally.
these are the biggest myths.
Totally, yeah, that's right. We don't see what happened behind the scenes. We see the end result, and
Hmm.
it shapes our picture. And it's true that fertility technologies has evolved so much in the past decades that
Yeah.
it can be a long journey and a lot of technologies involved to families actually having children at a later age. Yeah. So if we think about women in perimenopause who are coming to you, what would you say? How does this perimenopause journey affect your like chances of getting pregnant? Can you still get pregnant? Can you
Mhm.
walk me through this?
So also that depends a bit on where, like, I think for fertility, the most important thing is still the age. So unfortunately, we get our eggs once we were born, and then they basically they get older the older we are, so that means the quality also gets less and less the older we are. So if you have already perimenopause symptoms and you're 38, which could happen, but you still have a regular cycle and you still have actually kind of normal hormone levels,
Mhm.
then it's still very possible to become pregnant, right? But if you're 45 and you have like, I don't know, really low AMH levels, so really low egg reserve, and maybe your cycle is getting shorter because that's kind of an early sign of perimenopause. So, for example, you had a 28 cycle like all your life, and then it suddenly becomes 26 or 24 days. So, this is also an early sign of perimenopause, and that could affect also your fertility. But I would still say that for fertility, age is still the most or the biggest factor for because we can't really solve this. So we kind of try to improve egg quality, but we can't really, um, yeah, we can't beat biology in that way.
Right, right. Yeah. I see that a lot of new people are joining us.
Oh
So
yeah.
if any of you have questions, please type them in the chat. And Dr. Nadine and I will keep a look and we'll try to answer anything that comes up. But I do have questions that our audience submitted in
Hmm.
advance. So, for example, Strawberry Health helps women to understand their hormones and hormone levels. And a lot of women are coming to us to see if they are in perimenopause,
Hmm.
which we can see the signs in levels changing, like anti-Mullerian hormone starts going down, follicle stimulating hormone also changes its levels, and we can get these signs. So how do you use these lab results with your clients?
So it gives us a bit clarity, and I must admit that strawberry is actually pretty amazing because you don't need to go to a doctor's office. You don't need to have like a big hassle of being like, oh, where do you get the test? Which test shall I get? So it's very easygoing, and especially since all women are totally busy, it gives you a really low barrier to test the hormones. And it's also for me as a coach, it's easy because I can just tell them, hey. you can order this test there or can refer them. So,
Yeah.
and once we got the results, we have a bit more clarity, right? Because it's always a bit of a question: is it perimenopause, or is it maybe my thyroid, or do I have like other problems like iron deficiency or whatever, right? So,
Right.
once we've got the hormone levels, we can see what's going on in your body. And for perimenopause signs are, for example, that as you said, the AMH level gets quite low. It doesn't need to be totally like not gone, but it is lower. And also, if you hit perimenopause, it's a little bit also genetics. So some hit it a bit earlier than others. So you can't really say like, oh, I'm 40, so I have for sure perimenopause, or I am 35, I have for sure no perimenopause. So it's
Yeah.
always good to know that level. And another sign is that the FSH is the follicle stimulation hormone, and this is produced in your brain, in your hypophysis, and sends to the ovary the sign, hey, produce some follicles. And in when you hit perimenopause, your body tries to produce as many eggs as possible. So it's like really trying to yeah, force the ovary to do something. So the FSH level gets higher, and that is a sign too.
Mm-hmm.
The LH depends a bit, it's still very up where you are in your cycle. And the estrogen level usually gets lower, and
Mm-hmm.
also the progesterone level, and that makes it also harder. So first of all, it leads to cycle irregularities, and it makes you feel this being off, right? Like estrogen is a very cool hormone, actually. It's our superpower hormone. So it makes you feel pretty, your skin gets nicer, you're like, your hair is nicer. So if the level decreases, you feel maybe all these signs, like I don't know, you get hair loss maybe, or you feel like your skin routine needs to change because something changed. You have like dry skin on your body suddenly, something like that. Might be a sign to maybe just test your hormones and see what's going on.
Right, right. So I love it. So you use the levels as the like a clear picture of what's going on with this particular
Hmm.
woman, and it gives you this baseline where you
Hmm.
are working from.
Yeah.
Okay,
I mean,
fantastic.
I must admit, sometimes it also makes sense to check again on a different time of your cycle.
Yeah.
So the AMH level, not so much because that is quite stable. So we usually say like normally it should be stable around 6 months. So some say 3 months, some say 6 months. I think it depends a bit from which perspective we're looking at it. For a fertility's perspective, test it maybe a bit more. For a perimenopause perspective, I would say every 6 months is totally fine. But like estrogen, progesterone, LH, and FSH can also vary during your cycle. Depends a bit when you test it. So
So,
sometimes I might also request, hey, it might make sense that we test it again on a different time of your cycle to get the full picture.
yeah. I see the first question in the
Oh yeah.
chat. Are there specific hormones that the Strawberry Health Hormone Kits focus on? What can the lab results tell you? First of all, yes, there are specific hormones included in the Strawberry Health Test Kits, and we have three different options. The lightest option is just the AMH test for ovarian reserve, and the most comprehensive panel includes 9 different hormones, including AMH, FSH, LH, estrogen, and testosterone levels too. So it depends on how deep you want to know what's going on with your hormones. And I would love to hear Dr. Nadine. So, for example, we get women who test their hormones and their AMH level turns out to be low,
Mhm.
and they are usually shocked if they test AMH for the first time, because some of them are still in their like early to mid 30s and think that they have a lot of time ahead to start a family. So what can this AMH level really tell you and what it cannot tell you?
Mhm. So, as you said, like the MH level test is sometimes also a bit tricky because it puts women in a position where they start really worrying or feel like, oh no, why did I do this test? Now I'm like totally off. So, it's also important that we explain this test very well. So, the good thing is if you test your AMH level, you have a good picture of what's going on and how much time you have. So, it's more about egg basically quantity than quality. So it doesn't mean that if you have a low AMH level in your early 30s that you can't get pregnant. That's very important. But it does mean that, for example, if you wish to have 2 or 3 kids, that you might not have time till your end 30s or beginning your early 40s. Or, for example, if you don't have a partner in your early 30s, but you wish to have kids, you might need to do different decisions, like either thinking of becoming pregnant or getting a single mom, or do egg freezing, or do even embryo freezing with a sperm donor. So all these options are there. But I always feel like it's good to have to know, because then you can decide specifically for you or individually for you what is best for you. But it doesn't mean that you can't get pregnant. That's very important, because, and we have also a low AMH levels in your early 40s, and they still getting pregnant with a second or third kid. So it's just, also, we don't know so far how fast the AMH level lowers. So that means, like, for example, if you have an AMH level below zero point 0.1, I can't predict for sure when your menopause starts. We know that it might start in the next 5 years, but as you can see, like 5 years is a big range. I didn't say in the
Right.
next 4 months. So that it means, like, it's a good test to know what's going on and to make decisions for your future. But it's
Mhm.
not a test where you can predict I can get pregnant or not.
Right. Okay, thank you so much for this comprehensive answer. And I see another question from the audience. Is there a way to evaluate and improve egg quality?
Yes and no. So, so a big thing, and I think this is also something Strawberry Health is doing a lot. We need to educate women, and especially also, I think, young women, teenagers,
Yeah.
because what you do to your eggs, or what you do in general with your life, impacts your eggs. So, for example, alcohol, smoking, drugs are very bad for your egg quality. But as we all know, I mean, when we're young, we don't think about this. I mean, we want to have fun, or try different things. But unfortunately, since your eggs are not renewing, everything what we do to our body affects our eggs.
Mhm.
So that means we can improve our egg quality with our lifestyle. So it's a bit like with all lifestyle stuff. I know it sounds a bit boring, but it's like, eat a lot of proteins, fibers, like having like a good Mediterranean diet, don't smoke, don't drink, have like a healthy sports lifestyle. So this is, of course, impacting our eggs. Some also say maybe toxins or plastic, but I must say the
Mhm.
research is not quite clear about that yet. So
Yeah.
some say it's very important, some say could be. We definitely know that egg and sperm quality lowers for like the last decade. So that means something is apparently different than to like our pre-industrial century,
Right, right.
but we are still not for 100% sure what is really affecting it. And what we also can do to improve our egg quality actually is supplements. So a few things we can't really cover with our nutrition. So, for example, omega-3 acids, this is quite hard to do that with just fish and oils and stuff. So that is a good supplement, either for egg quality, but also for longevity.
Mhm.
Um, then also vitamin D is very important. I mean, we are now luckily in California, so we get a lot of sun exposure. But in most of the countries, vitamin D is mostly a lack. So, and that affects a lot the egg quality and also your mood, and also good for perimenopause, by the way. Some also say coenzyme Q10. This I
Mhm.
would say is maybe not a must for like your daily life, maybe more when you really want to improve quality for your fertility.
Mhm.
Yeah, those are, I think, the main supplements which are very
Wonderful.
important.
I love that we moved to the topic of how to support your fertility with your
Hmm.
diet, your lifestyle, and supplements. And I will ask you, Dr. Nadine, to submit all of the list of the supplements that you
Hmm.
mentioned after this live so we can
I
save
see. I
it.
actually have a
But
supplement guide for that because
yeah.
everyone is asking me.
Yeah, because it's amazing. It's a very important information that we don't get from our physicians and from OBs that we are going to, right? They are not covering as much our like egg quality,
Mhm.
fertility. And I think as a woman myself in my mid 30s, I didn't learn about all of these nuances until I actually have children,
Yeah.
which is quite crazy. Like, doctors should have told me.
Also, you never get asked, right? I mean, I
Yeah,
know that it's, again, I think a doctor can ask like a woman in her early 30s, do you think about having kids? Because I feel
right.
like, oh, some know that's offensive. So no, I don't think it's offensive because you need to ask that questions to know how you educate that woman in front of you, right? I mean, if she says like, no, kids are not an option at all, I'm totally fine with that. I know that for sure, 100%. Okay, it's fine, yeah, right? But if she does maybe, then at least you need to tell her what her options are, right?
Exactly, exactly. Yes, you're doing very important work educating women beyond what we get at the doctor's appointment. I see another question in the chat. How often should I test my AMH levels?
Um, Also depending a bit where you are in your life at the moment. So if you're thinking of, I don't have kids yet, I'm in my early 30s, and I think about maybe I'm single or I just have a partner, and I'm thinking of how much time I have, I would say every 6 months to a year is fine. If you are more in a fertility perspective, I would say every 3 months makes sense.
Mhm.
Um, Except something is changing. So, for example, if you, for example, start treatment and stuff, you don't need to test it all over again. But just having a bit of a heads up, especially if the AMH level is quite low compared to your age, I would also suggest to test it more often than less. If you have a normal AMH level, you can test it less. So then every 6 months or a year is also fine. In your when you're hitting like perimenopause, I feel like it's actually fine to test it just once and then go from there because then it doesn't have that much impact on decisions anymore.
Right, right. So regarding AMH, once again, it seems to be a topic of our
Hmm.
webinar today. We see a lot of our clients are working women who are still very much focused on their careers and have partners or don't have partners or recently broke up, all sorts of relationships. And when they discover their AMH levels, they usually have a question. So, what do I do now? Do I go straight to egg freezing? Do I still have time? How do you go around that?
Also tricky. um, yeah, this is also individually decisions, right? It's like
Yeah.
quite hard to answer them in
So
general. But
what it depends on.
mhm. So I think you definitely should inform yourself about your options. So this is number one, right? So once you got your AMH level, I think you're in your so with egg freezing, the thing is the younger you are, the better it is. That means so the younger you are, the less eggs you need and the better qualities they have. So the higher the chance is that you have a baby at the end out of those frozen eggs. So if we would like cut that down on something, we would say if you're 18 or 20, actually perfect. Because most of the time you only need one round, like one, basically it's kind of like an IVF cycle. So one round of injections and egg retrieval, because mostly you get them 15 to 20 eggs, which is totally fine for that age. But as we all know, like, first of all, it's quite expensive. So when you're 18 or 20, you might not have the money for it. And you most of the time don't think about that because you feel like, I don't know, I have time, I might find the right partner. So let's see what's going on. So I would say most of my patients who came for egg freezing were between 30 and 38. And I think the peak was even 35 to 38, which
Okay.
I must admit is already quite late for egg freezing because
Mm-hmm.
you need quite amount of eggs to have a really good chance that you can take a baby. You say like baby take home, right? So you can basically take a baby out of these eggs at home.
Right.
And I think this is also something to be honest about, that it can be an insurance. And I think, especially if you don't have a partner and if you don't feel like I'm going to do this now by myself because I don't need a partner, this kind of the last option, right? So either you decide not to do it, but then it might be just you have no option at all anymore at some point, or you do it, but then you also need to have a full picture that is not 100% insurance rate, even though you do it.
Right. So the older we get, the harder it is to extract eggs. That's what I hear. Is it correct?
Yeah, basically, because the thing is, as we said, like the AMH level lowers once we're getting older, right? So that means we have less eggs. So this is more about now the egg quantity, not the quality. But we recommend, for example, if you're 35, to freeze around 35 eggs to have around about 90 to 95% chance that you have one kid out of them.
Oh,
And
wow.
this is gives you a bit of a perspective, right? 35 eggs to have one kid. So
Yeah.
that means, so there's a lot of eggs are maybe not okay once we retrieve them. A lot of eggs might not survive the thaw process. A lot
Yeah.
of eggs might not fertilize, or they don't develop to an embryo. So that's why we need so many eggs. But for example, when you're 20, you only need 20 eggs because the quality is much better than compared to a woman who's 35 years old, unfortunately.
Oh, that's interesting. So how realistic it is to get like 35 eggs when you are 35 years old?
Also depending a bit on your age level. So let's say it's a woman, 35, average AMH level, everything is fine, she has no risk factors, didn't smoke, totally healthy. So then I would say mostly we try to get like 15 eggs per cycle, because we can't also get too many eggs, otherwise we have too many risks per cycle. So I would say she needs 2 or 3 cycle to get all these eggs. But this is
Right.
also, of course, a lot of money then, because every cycle costs quite a bit of money, right?
Totally, totally. Oh, yeah, they're quite expensive. All right, thank you so much for covering that. And if we come back to the topic of how can we support our fertility, uh, diet, what else? Diet, supplements. Is there anything else that we can do in our daily life to support our hormones and fertility?
It's again like, as you said, I think you also shared a bit your lifestyle, right? The last days or the last weeks, that you try to change your health and your women's health and go back to sports and nutrition. So I think most of the things.
Enjoying it too.
Mhm. So actually, to get a bit more information about that, I think the longevity bubble is also very good for that because longevity and egg quality is really aligned. So all the tips you get from the longevity doctors or like Instagram profiles, this works as well for the egg quality. So that means we should eat less sugar because insulin resistancy is also a big factor for fertility. So same is for our weight. So if we have like it doesn't mean like we need to be like totally shrinked, right? It is more like about having a healthy weight in a certain range helps also with fertility because obesity makes it also harder, especially also like high sugar levels in your blood makes it harder. High cortisol levels in your blood makes it harder. So that means like all these lifestyle advices we get, like try to, yeah, create a lifestyle where you don't have all the time negative stress. I talk about negative stress because I feel like otherwise women are sometimes stressed about the stress. Like when you're asking, oh, don't stress yourself, then you get pregnant. No, 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 I don't mean that. I mean, it's totally fine. We all have stress and we can't, I mean, it's our normal life, right? You can't just like have no stress anymore. That's not working. But it depends a bit how you deal with the stress and how you feel about the stress, right?
Mm-hmm.
So things like that. Or also same as for nutrition, like don't make it too hard for yourself. Just do whatever works for you in a good way. So either if it's like ordering from a company who provides healthy food or do meal prep or all these things, try to do what works for you. And I always tell them do the 80-20 rule. So 80% of the time try to make it happen, what your goals are. 20% is also fine to have a glass of wine, have a chocolate, have an ice
Yeah,
cream,
relax
and
and
relax. Yeah.
enjoy what you
Enjoy your
love.
life. Yeah. Yeah.
That's important. Yeah, I guess that's important for stress levels too.
Totally. Totally. 80-20 is always good.
Okay, I love that. So you mentioned keeping a healthy weight and insulin resistance, and I actually have a question that our audience submitted in advance, and it's about polycystic ovary syndrome.
Mhm.
And can you tell us a little bit about how easy or how hard it is to get pregnant naturally
Mhm.
when you deal with polycystic ovary syndrome and what it is like in
Yeah,
general?
yeah. I just will say maybe not everyone knows what it is. So polycystic ovarian syndrome is basically, as it already said in the name, a syndrome. So it has certain factors to diagnose it. So one thing is mostly irregular cycluses, but in this way, it's more like longer cycluses. So you have, for example, 38 days, 40 days. Some don't even have a cycle at all. And in the ultrasound, it shows with a lot of cysts. So basically, a lot of follicles. Actually, it's not like cysts, like pathological cysts. It's really like a lot of follicles. So the ovaries have a hard time to basically choose one follicle which is growing and then jumping, and that makes it these long cycles. So and there's also a problem between the communication between the ovary and the hypophysis. So they do have, for example, different FSH and LH levels. They have usually a very high AMH level, which is in that way a good thing because they have a lot of follicles and a lot of eggs. So they don't have a problem with their egg reserve. And it also comes with metabolic problems, like, for example, insulin resistance. So some of them do have a higher risk for diabetes and do also have a higher risk for thyroid diseases. And that all this makes it harder for them to get pregnant. But it is not impossible to get pregnant. And especially what I want to, it's also a big myth I want to share today. It's if you have PCOS, it doesn't mean that you can't get pregnant, and it doesn't mean that you need definitely an IVF. So this is very important because
Okay.
it's not true. So it depends a bit. So there are also different stages of PCOS. You know, some have only a slight PCOS, some have a severe PCOS. Some you
Okay.
can, yeah,
How do you
sorry.
know? How do you know what stage of PCOS you have a
So
PCOS?
all the factors I just mentioned, you can see like if it is in the individual case, if that is the case. So for example, do they have an insulin resistancy or not? Do they
I see.
have a long cycle or do they have no cycle? If you have no cycle, it's much harder to get your cycle back than if you just have a longer cycle. So and that means you can change things with lifestyle, with supplements. For example, inositol is a very good supplement for PCOS. You can
Okay,
also
we'll
see like,
list it two under this video.
yeah. So, and also with your diet. So, for example, try to lower your glucose level in your diet. Some also take like anti-diabetic medication. We need to definitely discuss that with a doctor, but this also can help to get your cycle back. So, all these changes can affect that you might get your cycle back, or you just have a totally normal cycle and can get pregnant naturally.
Okay, okay, I see. Well, thank you so much for explaining it so well. What's your top tip to getting pregnant naturally for women who have PCOS?
Mostly lifestyle supplements, and then see how far we come from that. And if it's not working, I would always start with so what the problem is with PCOS, also the follicle growth. So that means they have a problem that the follicle is growing in a certain way and then jumping. And what you can do is taking medications called, for example, letrozole or Clomid. And this is actually a very easy way because they're basically tablets or like a medication you take like 5 days or a little bit more. It depends a bit on the PCOS, and then check in the ultrasound and see how many follicles are growing or if there's a follicle growing, just to support the follicle growth. And this is basically also a possibility to get pregnant naturally with a little bit of support, but you still go home with your husband and enjoy your time, and
That's
don't do an IVF
fantastic. Okay,
or your partner.
I do have more questions, but I wanted to give our audience a heads up that we have about like 7 minutes left in our live. And if you have any questions you came up with in the last minutes of this conversation, please type them in the chat. We still have time to answer a couple. And I do have a question that came up yesterday about, okay, I'll read it. I keep hearing that my high stress at work affects fertility. Can this be true?
Yeah, yes and no. So it depends on how bad your stress is and how you feel about it. So the thing is, like, stress is really hard topic. So maybe to have it like in an extreme way. So what we know about stress is that, for example, in countries where a war happened, especially like for example Second World War, we have a lot of data of that. We know that even though it was a really bad time, so people didn't have the right nutrition, people had the husbands weren't there, they were like had a lot of stress because basically feared the life. But the fertility rate or the pregnancy rate was the same as out of the time of war. So that lead to the conclusion that maybe stress is not as much an important role in fertility as we thought. But on the other hand, we have like that now in our industrial world, a lot of people have a lot of negative stress, and our fertility rate is dropping. So I think it's a bit both. I think the answer lies basically again in between. So I think if you're coping your stress very well, so for example, some women love they have like a bit of a driven job, right? To be like from there to there and have meetings and love their job. I guess like at Strawberry, for example, you were in a building process of a whole company. I bet you had a lot of stress, but I bet also that you might like it because it's like your company and you love and you're passionate about what you're doing. But if you, as the question was from this woman, it sounded a bit more like she's stressed in a not really good way in her company. So that means she might have stress with, I don't know, anxiety comes up, or she has already like a higher cortisol level once she enters the company or her office. So that might affect your fertility. So we definitely know that cortisol levels might have an impact. Unfortunately, cortisol levels are hard to test because the
Mm.
cortisol levels are naturally fluctuating during the
So
day.
much, yeah.
Yeah, so even though we get like one lab result, it doesn't really give us a picture on how much your cortisol level is like high or low during your day.
Right. Okay. Okay. Thanks for covering that. Okay, we've got a question. Where shall I start with testing with me and my partner?
Mhm. So maybe we answer first when. So I always recommend to test whenever you feel like it. So there is like this guideline where we say normally you can try to conceive around a year before you're 35, and after 35 you should seek for help after 6 months. So but I always think like it's quite a long time. So honestly, I was 33 when I started trying. And I would have freaked out if someone told me like, wait for a year and then have a look. So when you start, I would say if you have a history of something, especially like endometriosis, you know already have PCOS, or you know you have irregular cycles, or you have a lot of pain during your menstruation, I would also rather seek for help earlier than later. And how
Mm,
you start is usually that we check first your cycle. So that means start with putting down when is your first day of your period, and then maybe start with ovulation tests. So usually you can start, so let's say you have a 28-day cycle, you can start like around 10 to 14 days and then start with ovulation tests, see what happens, and see how long your second part of your cycle is. So we do have a bit of information about that. And then I actually would quite of soon start with having some labs as well and seeing is there any problems with your hormone levels, starting with an ultrasound if possible. So seeing if you have any problems with cysts, or if your uterus is in a normal shape, how your endometrium lining is. And then don't forget, please, your husband or your partner, send them to a sperm analysis. He's 50% of
right.
the whole picture. So, and women unfortunately are very tempted to always have a look at their own and think it's their own fault. Please, your husband is 50% of the whole picture, so send them to a semen
Right.
analysis, and that is a very easy test. So yeah, I would do that right at the beginning.
It's so great that you highlighted them. Yeah, because we see fertility as a women's issue so much of the time, and we
Hmm.
have a partner, right, whose
Yeah.
sperm is used to make these babies. So, for example, for women, we can send them to Strawberry Health to
Hmm.
collect their blood sample at home and get the labs before they book an appointment with you or go
Hmm.
to the fertility clinic. And for men, as I hear, it's a sperm test. Where
Hmm.
can they do it? Like, what sort of a sperm test would you recommend for the partner?
So I would actually recommend even a fertility clinic or a urologist, andrologist, who are a bit more specialized in fertility, because sometimes urologists don't have the experience to do the proper semen analysis, because it's very good to have an eye if these semens can actually fertilize eggs. And usually fertility clinics or andrologists have a very good experience about that. So I would also recommend, if you can, to go there. There are also some at-home tests nowadays, which are quite good as well, at least if you're starting, and if you feel like okay there might not be an issue, just have like first picture what's going on and then go from there.
Right, right. So, would it be enough to do like at home tests for yourself, for your partner, and come to you for additional support?
Oh yes, of course. Yeah, yeah. So especially if you just started trying, or if you're like just thinking of, I want some support to also understand my cycle or what's going on. So usually, um, I actually recommend to have them more lab tests. So we start, for example, we start with strawberry. We start that on day 5, or like in the early 5 days of your cycle, with the bigger hormone panel. So where it's AMH tested, FSH, LH, estrogen, progesterone, testosterone. And
Mhm.
then once we hit ovulation, it's sometimes nice to have an estrogen, LH, and FSH level to see
Mhm.
how good your ovulation actually is. And
Mhm.
then 7 days after your ovulation makes sense to test your progesterone level, because then we actually really know how good the quality of the ovulation was and how good your second part of your cycle is. And if there are any issues, for example, lower progesterone levels or too short cycle. And then we got actually a really good picture for the beginning. And of course, the sperm analysis. And then we go from there, and then we see what we can do to support it first, naturally. And yeah, and then we go from there.
Fantastic. Well, thank you so much, Dr. Nadine, for this extensive overview of hormones, fertility, and how we can better understand our bodies and support ourselves. And where can our audience find you if they want a consultation?
Yeah, so I do have an Instagram account. I guess you know by now when you joined this live. It's my name is just Dr. Nadine Al-Kaisi. I do have an Instagram account, but there's not that much going on, I must admit. From my company, it's Excellent Fertility. And if you want to book me, or if you want to just have a call with me to get to know me, you can find me at Excellent Fertility. So it's EGG and then excellent.fertility.com.
Thank you so much. Everything that you mentioned today that you recommended, any special offers that we have for our audience, we will put in the description once this live is saved to our
Sounds good.
Instagram feed. So check back for all of this info later today. Thank you so much, Nadine. It was so nice to have this conversation with you. Thanks for joining.
Thank you so much for having me. It was really nice. And let's have a coffee soon, maybe.
Let's do it. Yeah. Okay. Have a good day, everyone. Thank you
You
for
too.
joining us.
Bye.
Bye.